We have Dr. Richard Friesendorf, and we are doing his reevaluation after he had gone through 2 weeks, about 6 of our neurofeedback, transcranial neurofeedback therapy, and we did some laser therapy for the peripheral neuropathy of his legs and feet. He was diagnosed with Parkinson's, and he does have a little tremor in his left hand. And it has affected his cerebellum, which controls eye movements, balance, accuracy, and coordination, affecting his ability to ambulate and walk with a normal gait. He used to have almost like a drop foot, like a limping type gait. And now we're going to evaluate if there's any improvements in these symptoms. So, Richard, if you could chime in on what improvements you felt after going through our treatments.
I feel about 20 to 25% improvement in the neuropathy.
So more feeling in your feet?
Yeah, I think so, a little bit.
Okay.
Actually, my tremor is in my right hand. You mentioned left, it's more in my right hand.
Okay, yeah, right. The other right.
The other right.
Uh-huh.
And that's about the same, actually.
Okay, all right. But as far as your ability to walk, that's about how many percent better?
About 25% better.
Okay, that's great.
Yeah.
Can we have you get up and let's see how you're ambulating, because I want to compare that when you first came in. So, and why don't you go ahead and walk across the floor. So he's able to be more independent. He doesn't have to depend on that walker as much. All right. All right, Doc, turn back around and come on in. So before, that would have been very difficult, or you'd have to him out of the chair.
Yes, sometimes.
Yeah,
He
yeah.
has a lift chair at home.
Okay, but the fact that he could get up on his own power and not have to lean on you or his walker, and what improvements have you felt or you've seen?
Well, I know that his walking and his breathing has improved, because usually we have to stop like 3 times, but then we're not even more than 2 blocks away. But since the treatments with the legs, I noticed that when I touch his feet, they're not hurting. He doesn't feel the pain like he used to, and the numbness is not. It's not really numb like it was before.
Okay.
Yeah.
You could feel better, yeah, and that's going to improve your balance, so you can ambulate better.
And more length in walking. He can walk a longer distance than he could before too with this treatment.
And you would.
My breathing is what holds me back most.
But your breathing is actually improved after then. All right. You have some COPD, right?
No, he's got some breathing that's affected by what's going on in his brain.
Yeah, the centers that control the breathing.
Yes,
yeah.
It's not everything else has been checked out. It's not COPD.
Okay. Yeah. Well, that's again a brainstem issue. You know, the autonomic nervous system not doing its job to regulate the breathing. So, what about before? You notice he was dragging his legs?
He drags to like a lift foot. Yeah,
Okay.
the foot drags. The
And then-
tighter he gets, the worse the foot
And then
drags.
after the treatments, what have
After
you
the
noticed
treatment,
about
he
that?
just walks out of here. Actually, he leaves me walking now. When
Wow.
we finish the treatments.
And that's about what overall? How many percent improvement would you folks say you've had
I say
after
at least
the?
35 to 40 if we're going to do it all. I would say.
And what about
I'd
yourself?
say about 20 to 25%.
Okay, so what would you say? Just looking at his functionality.
Oh, I think he's doing better.
Yeah.
I think he's doing better.
Yeah, so I'd chalk it up 30%, which is remarkable considering.
Yeah.
You know, we
And
did
that's short of time.
exactly. So, I think the trial was successful, and we'll see what we could do to even make more market improvements. So, congratulations, Doc, and we'll take it to the next level now. Okay.
Okay, sir.
All right.